As you likely remember, just a few weeks ago, model Chrissy Teigen and her husband, singer John Legend, announced they had lost a son due to pregnancy complications and just posted heartfelt photos and a letter. The 34-year-old said doctors diagnosed her with partial placenta abruption, which is when the placenta separates from the wall of the uterus before birth. Now, it's not uncommon for some women to have complications involving their placenta during pregnancy. A Central Indiana woman recently had a serious scare and ended up in the hospital for several weeks before doctors were able to successfully deliver her daughter. And she's joining us this morning to talk about the complications. New mom Tisha Unger with baby, and Dr. Tova Bikema, a maternal fetal medicine doctor at Ascension St. Vincent. Ladies, good morning to you. And Tisha, I wanted to start with you since you're holding baby. How are you doing? And just kind of take us through a little bit about how scary this was for you.
Sure. I'm about a month out of surgery and delivery of my baby Elle. She was born about 35 weeks. So my first pregnancy, I had preterm labor where I went into labor early. My second pregnancy was smooth. They were both C-sections. With baby Elle, at about 20 weeks, I was diagnosed with placenta previa, which is where the placenta lies low. At my 30-week scan, I was diagnosed with placenta accreta. And then at my 32-week scan, I was diagnosed with placenta praecreta, which is the most severe case that you can have. At that point, the maternal fetal medicine at the hospital that I was currently at said, "You're not going to deliver here. We're going to take you up to St. Vincent where they have a specialized team in place. They're more knowledgeable on the situation. You'll have the best care that you could possibly have." And from there, it escalated fast. I visited Dr. Bikema the next day. I was at 32 weeks at that point, and at that point she said, "It's catastrophic if you leave here and you don't admit yourself into the hospital."
Oh my goodness.
That's where I was for a couple of weeks until I was about 35 weeks, and my doctors we had a great team. Everybody was there for the scheduled delivery and surgery, and by the grace of God, everything went well. And here we are now.
Oh, I'm so glad. Look at the beautiful baby. Beautiful baby Elle. Dr. Bikema, I want to bring you in here. You guys have a great distinction there of a level 4 center, which is a big deal for Indiana. That's somewhat new. What do you want people to know? Because I know we're going to run out of time here. We could talk for a long time about this, about what women need to know and how important it is to be aware of these types of things.
Sure, absolutely. You know, pregnancy doesn't always go as smoothly as planned, and Indiana has recently introduced levels of care and has designated St. Vincent as a level 4 perinatal center, which essentially defines hospitals which provide comprehensive medical and surgical care to the most acutely ill and medically complex mothers and infants. And the diagnosis of a placenta accreta requires significant coordination of care. And that certainly is something that we do here well at St. Vincent that I think exemplifies what a level 4 perinatal center provides to both moms and babies.
Yeah, and we heard Tisha talking a lot about kind of the stages, you know, and what she was first diagnosed with and how kind of it kept going up and more extreme. Again, I want to just kind of dive into that a little bit more in the last little minute we have here on what expecting moms should be aware of and, you know, anything that they can do. I mean, is this just something that happens and there's nothing you can do about it?
Yeah, so there are certain risk factors for what Ms. Unger had. Placenta accreta generally occurs in women that have had uterine surgery before, whether it's myomectomies or cesarean section deliveries, where the placenta essentially implants too deeply into the uterus. And this is a condition that ultimately should be detected on ultrasound before delivery, so that careful coordination of care and delivery can be undertaken once the diagnosis is made. Essentially, the placenta in these circumstances doesn't detach appropriately after delivery, which can lead to hemorrhage and can be very significant and even fatal if undiagnosed prior to delivery.
Dr. Bikema, thank you so much. Tisha, baby Elle, we are so glad that you are happy and healthy now.
Thank you so much.
Absolutely. All right. Thanks, you too.